Hey there, Dr. Bates here. Just one, trying my new setup here with microphone, streaming, giving all of it a shot. But I also had a subject matter that it was brought up to me that I kind of neglected to cover in my reflex hammer video. And that would probably be actually the two most commonly used methods for testing reflexes. And I'm a little opinionated about them. That's probably part of why I forgot about them in the first place, but they're used fairly frequently. And number one is the stethoscope. Great tool for listening to the heart and lungs. Though even listening to the heart somewhat, it's hotly debated. Cardiologists that I trained with called them guessing tubes. And honestly, for most of us out there that aren't cardiologists, it very much is a guess. Wait, was that a recurrent stenosis? Let's see here. Try to think of the little triangles and whatnot. Yeah, guessing tubes. I'm definitely going to agree with that. But also, they are still a diagnostic instrument using listen to the heart, listen to the lungs, listen to the belly. There's a reason for using it. And they're not cheap. For those of you that aren't in med school, these are not cheap. So why are you banging around the acoustic side of another diagnostic tool into somebody's knees when this thing costs like $200? This costs $9 off of Amazon, and then everybody gives them away free, like this one that the Air Force gave me when I joined. Clearly, I haven't used it. Clearly, I have a thing against tomahawks, but again, if it's free, why aren't you using it? And you're going to use your expensive stethoscope that's used for something else. Just saying. But hey, the greatest tool you have is the tool that you actually have with you. And that brings up the other commonly used one, which is hands. And actually, I will admit, I probably test reflexes with my hands 60+% of the time. Why? Because some of the clinic rooms have them, some of them don't. I'm cheap. I'm not buying it's cheap, $9 on Amazon, but I'm not buying a $9 instrument to throw in an Air Force exam room that I'm probably not going to remember to take with me when I move. So why am I going to do that? Half of the exam rooms have reflex hammers in them. The other half doesn't. So I'm in an exam room with a patient with back pain. I'm still going to check their reflexes, but I'm going to use my fingers. If I feel like I'm not getting a good, reliable result, okay, that's when I walk to another room or I walk to my office and grab my actual reflex hammer. It's easy enough, especially the patellar reflexes, Achilles reflexes, the ones that are tested most frequently. Just like doing it the other way, a couple fingers there on the insertion, and just kind of like percussion. It usually works. And also, I don't carry a reflex hammer with me because I'm trying to look like Tom Cruise in a flight suit. How many doctors get to wear a flight suit to work? And let me tell you, having a reflex hammer hanging out of a pocket just kind of kills the whole flight suit appearance. I guess it all maybe comes down to appearances. It's much easier and much cooler for a doctor to be walking around like, yep, I got my stethoscope, and you know what? I can also check your reflexes with it. Or be like, yeah, I'm a master of reflexes and the human body. I'm just going to use my hands. I know that some people use a hammer, but you know what? I'm awesome. Yeah, it could be, to each their own. I've used every single version out there. Well, every single version that I've covered. If I've missed one, let me know. But they definitely work. As I said earlier, the best tool you have is the greatest tool for the job is the tool that you have with you. It works. Might not be ultimate, but overall, when it works great. But still, stick to either this one or the Babinski's Queen Square are my preferences But sometimes you can't always do that when you're in the ER or when you're in a clinic and somebody took the reflex hammer because they wanted a souvenir from the doctor's office. It happens. But yeah, hopefully this whole live stream went well, easy. The audio is good. Hopefully, I don't know if you can hear the airplanes flying overhead, but that's what happens when you live and work on an Air Force base. So give me a comment if there's anything you'd want to know more of. I'm looking forward to doing more of these and extending the options. Thanks for joining me. Thanks for watching. Go ahead, like, share, and subscribe this video, and check out the other videos that I have. Thanks.